The standard for treating coronary artery disease in de novo lesions is currently the implantation of drug-eluting stents. However, especially small vessels are at risk of stent-related complications such as in-stent restenosis and stent thrombosis. The resulting disadvantage of DES is a prolonged dual antiplatelet therapy. In contrast, the drug-coated balloon SeQuent Neo enables the treatment of de novo lesions without stent-related disadvantages. Adequate lesion preparation is mandatory to treat a de novo lesion with DCB angioplasty. For this purpose, B. Brown offers a wide variety of balloon catheters. According to consensus group recommendations, after successful lesion preparation, patients can be treated with SeQuent Neo. During an inflation of just 30 seconds at nominal pressure, SeQuent Neo's therapeutic agent paclitaxel is released into the vessel wall with the help of the excipient iopromide. This implant-free treatment requires only 1 month of DAPT. Furthermore, DCB-only treatment supports positive vessel remodeling and can lead to late lumen enlargement. The safety and efficacy of SeQuent Neo has been clinically proven through an extensive clinical program with numerous trials for ISR and de novo lesions. The milestone trial, Basket Small 2, demonstrated non-inferiority of SeQuent Neo to second-generation DES for the treatment of de novo lesions. After successful lesion preparation, 758 patients were randomized into the DES or SeQuent Neo group. At 12-month follow-up, the primary endpoint MACE was comparable between both patient groups. SeQuent Neo is therefore a safe and effective alternative to DES, offering additional advantages of implant-free coronary angioplasty.